we go. I will pin you, make you the big, perfect. All right. Thank you everyone for coming. We'll let Sarah take over.
Hi everyone. First of all, I'd like to thank the Think Pink Foundation at Living Centre for having me present to you today. And if some of you have seen one of my presentations before, because I do it about once a year, some of the slides are the same, but some of the slides are also different. And I've forwarded on a PDF copy, so you can get that as a reference afterwards. But just to make note that I am actually talking to the slides. So there's a lot of information that's also not in those slides because we'll be talking about them as well as we go through. And if you have any questions, perhaps just jot them down. And then at the end, I'll make sure we've got enough question time for everyone, because there's probably some things you'd like to know that I can either find out afterwards, or I might have actually get to a point where I can answer it later on in the presentation. So what I'm going to do now is share my screen. I will just go back to doing that. Okay. So I think everyone should be able to see those slides come up. Can we see them?
Not yet.
Not yet. Okay. So maybe just let me go back. I am just going to, I'll just do share screen again.
Oh, good.
Does that one come up? Yep, great. I will just make that a little bit bigger for me. Thank you. And yeah, I just needed to do a little bit of remedial work there on myself. So as you can see, so I'm a lymphedema practitioner. I work in country Victoria. So I work near Woodend, which is in the Macedon Ranges. So I'm just going to go back a couple there. I work in Woodend in the Macedon Ranges, and my clinic is pretty diverse. I'm a private practitioner, and I see lots of different presentations of lymphedema. Some of them are from cancer-related surgeries, others are primary, so it's something that somebody's had a condition from birth. But I would say that about 40% of my clientele are clients who have had breast cancer. So the presentation I've put together for you today is really kind of the information that I present to my clients. Last week was Lymphedema Awareness Week. You may or may not have known, but yeah, Lymphedema Awareness Week is in Australia, we have it on that date, and the actual Lymphedema Awareness Day internationally was on the 8th of March. And it's just really good if whenever you get the opportunity to also talk about lymphedema with other people who you might know in different groups, because lymphatics is sort of something that we don't really know much about until something needs to be fixed with our body. And then we really need to get on top of things as fast as we can. So the more information that's out there for people, the better. So the first thing I thought I'd do is just talk a little bit about the lymphatic system, because most of the time that we sort of think of our lymphatics as just our lymph nodes, and certainly breast cancer clients, you know a lot about your axillary lymph nodes, so that's your armpit nodes. But the lymphatic system itself is actually a network of these tiny little vessels throughout the body. Your lymph nodes and the deeper system, that only takes up about 20%. The rest of it are these tiny little vessels that are just underneath the skin that carry the fluid through, and that makes up about 80% of the actual system. In any medical diagram, the lymphatics are always shown in green. Now, your lymphatic fluid is not green, it's actually quite clear. But the main job of the lymph vessels is to actually carry fluid through the body. So, and the way it's really activated is through our muscle movement and changing pressure. So I'm going to be talking a lot about that today, just how we can get our lymph vessels moving when we need to. This diagram here, that's showing the deeper lymphatic system, and the little round balls that you see, they're actually the lymph nodes. This is just another picture. So some of these, they can look a little bit confusing when you see it the first time, but it's really because I want you to think of the lymphatic system as a pump, and its key functions is to maintain that fluid level in your body. It also helps to protect you from foreign invaders. So that's why if you get a virus, all of a sudden your lymph nodes swell because your lymphatic system is working more efficiently. It wants to really accelerate to try and find out what that virus or that bug is in your body. Its other job is to transport removal of waste products from the tissues. So if you imagine you might get a bruise from an impact or something on your arm, then it's actually the lymphatic system that starts to take up the byproducts of that bruise and clear the bruising away. So that's its main job. In this picture, you can see again, you've got your venous system, you've got your arterial system. So your venous and arterial system, that of course operates with your heart pumping along. You'll see that the lymphatic system, it doesn't actually go back to a pump. It doesn't go back to a heart or anything like that. So we rely on our muscle pump, so our body moving to really squeeze the pressure, move the skin, and that helps the lymphatics to pick up the fluid. And if you look at down the bottom, you'll see where it says capillaries. That's called the capillary bed. So what we're looking at there is the actual tissues, and the lymph system starts to draw that fluid up from the tissues. So if I'm talking today about tissues or subcutaneous tissue, I'm talking about the space in between the muscle and your skin, and you'll see that in some other pictures as well. But the main thing is that from this slide is that your venous system has the heart to pump it around. Your lymphatic system, it actually relies on pressure and your physical movement to get it going. So this picture here, and hopefully this little video will work. So this is actually, it's a illustration of an initial lymphatic vessel. And what we have here across the top, these are capillary fibers. So these attach onto our skin. And what you're going to see in a moment is that when I play the video, is that you'll see these little capillaries, they open up the lymphatic vessel. And so these are the little micro vessels that sit just underneath our skin. And then it pumps into the deeper system and starts to go through into our lymph nodes. So I'm hoping this video will work. It's working on my end anyway. So you can hopefully see then the fluids opened up, and you'll see these little sections called lymphangions. And lymphangions are like the little connector vessels going into the deeper system in our lymphatic, in the whole lymphatic system. And then it eventually goes into our lymph nodes and gets filtered. And where does all your lymph eventually go? Well, once it's been filtered, it enters into our venous system up around our subclavian vein. So if you've ever had lymphatic drainage done, most of the time people will work around your neck to start with, because that really encourages this pump, encourages the lymphatics to get moving. And that's where it all enters your venous system, then eventually through your kidneys, because it's all been filtered and out in urine. So I'm hoping we all get to see that video.
Yes, I did.
Okay, sorry, I don't have any other pictures up on my screen. I haven't been able to work it out. So I'm just glad we got to see that. So if we look here, they're the lymphangions. So these are the deeper kind of lymphatic vessels that all connect together. And one of them needs to be full for the other one then to pulse. So that's why it's really our body movement's really important. So that's just showing that video again. You'll start to see, so that's the fluid being drawn into the vessels, and you'll see they really do pump, and the lymphatic system's a really slow moving system. So it takes 18 hours for fluid to get from the tip of your finger all the way through your arm and into the venous connection at the subclavian vein. So it's a very, very slow moving system. And you'll understand a little bit more of that when we actually talk about lymphedema as well. So this is just one other diagram kind of showing a tissue bed there. And the main thing to really take home from just this first part of the presentation is that the lymphatic system is slow. So usually if you do start to develop a problem with the lymphatic system, it's not something that you just wake up overnight and it's there. It's usually taken a long time for there to be a buildup in the tissues between the muscle and the skin. We really rely on our muscle movement to keep the fluid moving, and internal and external pressure. So I'll show you some things, and I've got some videos to share with you as well on things like Tai Chi, where we can really move our arms around and try and change the tissue pressure and just the general pressure in our chest cavity. And also what's really important, and especially for anyone who's had interventions with breast cancer, is that the lymphatic system is super clever because it has this capacity to work harder when it needs to. And most of the time that has just taken place without us ever really knowing that it's happened. So it's really has the capacity to work a lot harder when it's required to. 80% of it, remember I said before, is between really the muscle and the skin. So you'll just see here on this picture, we've got these showing a few more nodes and a few more kind of directions of the deeper system of the lymphatics. We've got our axillary nodes. You can see there's a lot of nodes around the chest and also through the sternum and of course in our neck. Now, there are certain pathways that fluid normally travels along to reach lymph nodes and then get filtered. So if you imagine your right arm, the forearm drains superficially and then into the deeper system at the elbow. Then that comes up through here to the axilla, and then that pathway is into the subclavian vein here. So that's the pathway. And if you get swelling around your breast, the fluid will naturally drain towards the sternum and then up to there. So there's lots, that's the standard pathway that lymphatics work. Now, obviously, if we've had some interventions with surgeries or radiotherapy, some of these pathways have been changed. But a really important thing to know is that even when there's been lymph nodes removed, and you'll see I've written this over here because I think this is really important to know, is that the fluid is really rerouted along different channels. So the lymphatic system is able to adapt to the change that's happened in your body. And if we can keep it moving and keep the lymphatic system pulsing, then it really has that ability to find these little backdoor pathways to move the fluid. So for instance, if you've had a axillary removal on your right arm, right, a lymphatic therapist isn't going to be trying to drain your arm up through here. What they're going to do is try and drain it around the back to other pathways or across the top of your chest, or even down through your ribs or into the sternum. So there's lots of other pathways we can use to try and get your fluid moving when we need to. So then I guess we need to think about, so what is lymphedema? And lymphedema occurs when we do have like a failure in that lymphatic system, whether it be the superficial system, which is just underneath the skin. And that can happen a lot with breast cancer when we have radiotherapy, because the radiotherapy does a fantastic job at burning what needs to be burned so the cancer is removed, but it also then does burn all of those little fine lymphatic vessels that are underneath the skin. And the other thing that can happen also is then just with the surgical removal of lymph nodes or lymphatic pathways. So lymphedema occurs when, because of either of those reasons, the circulation of the lymphatic starts to fail. And you would think, okay, well, where is that going to cause a buildup in the body? It doesn't actually usually cause a buildup at that spot. It starts to cause a buildup further down the body. And then it also is in between just the muscle and the skin. So if we look at this little picture over here, this is these tissues that we're talking about. So when we do lymphatic drainage, it's a very, very light technique because we just want to move the skin, which pulls on a collagen fiber, changes tissue pressure in here and helps to draw the fluid in. And lymphedema can occur over any part of the body, and it can be classified as primary or secondary. So secondary is lymphedema that's been related to a trauma to the body, whether that be a trauma through surgical intervention or other interventions. Primary lymphedema is for people who have congenital problems, so they might have a genetic disorder. The other thing to know is that 90% of cases of lymphedema are secondary, right? So primary lymphedema is really reasonably rare. And of that secondary, 2/3 are cancer related. But I think it's really important for you to know that even though, so a lot of people think I've got cancer, I'm going to get lymphedema. Okay, and you'll see here there's some statistics on this page, and the references are all on this Australasian Lymphology Association. But it's really about 1 in 5 people who have some kind of cancer intervention will develop some kind of lymphedema. And that doesn't have to be to a really, really extreme state of lymphedema. It might just mean that you've had a breast reconstruction and your breast feels a bit heavy and tight, right? That's edema that's in there because of dysfunction of the lymphatic system. So I'll also, if you want to go onto this website that I've put down here, they have lots and lots of information on lymphedema, and that's from the Australasian Lymphology Association. And they're probably your best resource. They have a lot of consumer information as well. And that's probably better to go to than things like, Facebook groups and things like that, because they're the Australasian Lymphology Association, or I'll call it the ALA from now on, because that's a bit of a mouthful. The ALA are always checking on the latest research. So when we talk about the system failing, and that's because it's causing damage to our pipes, I wanted to show you this video, which is really clever because you're going to see how the lymphatics, once we start to get it moving, starts to get it pulsing. So up here, we've got the skin. There's some hairs on the skin. Underneath here are these tiny little initial lymphatic vessels or lymphatic capillaries. Down here, it's going into the deeper system, and here's our muscle layer. So if we get fluid developing, it's in this spot. And in this video, so that's a scalpel going through, and you can see we've had some leaking into the tissues through here from the lymphatic system. But see this little pathway through here? So the system starts to reconnect in these little backdoor pathways called anastomoses. So they're all over the body, but they won't actually get activated until they need to get activated. And that's why when we talk about lymphatics, we're talking about the drainage routes and how we can redirect the fluid, because we can often take some fluid from over here and move it to a different pathway. The other thing to note is that lymphatic fluid, so you would have seen these little yellow dots. I'll show the picture again. These yellow dots, they're representing proteins. So lymphatic fluid is a protein-rich fluid. And what happens is when the proteins leak into this area, that can then attract more fluid across from the venous system, and then that attracts more protein. So we start to get this cyclic effect in the tissues. And that's why it's really good if you start to feel any changes in your body that you just go and get it checked. Because if we can get that protein-rich fluid out of the tissues, then that really stops it from progressing down to further stages of lymphedema. So sometimes if I see a client who's had lymphedema for a very, very long time, so we might be talking 5, 6, 7 years, you'll actually see that their skin is quite hard and almost has like an orange peel look. And that's because we get so much protein within that tissue that it starts to change the skin. The other thing that we can get is called fibrosis, where because there's proteins in that area, it starts to lay down fibers around it. So the one thing to note here also is that lymphedema is slow developing. Remember I said it takes 18 hours. So for fluid to get from your finger all the way through in a healthy system. But if we leave just one little bit of extra fluid there, the next day there's another bit of extra fluid, and that can attract some more fluid in. So we start to get this cyclic effect. So what do you need to look out for? Now, this is all from the ALA website. So it's really important to know your body and how your body is at the moment, because obviously when you've had interventions like you've had with breast cancer, your body is now different to what it used to be. It's going to feel different. It's going to feel tighter. The skin might feel different. You might have some tightening under your armpit that you never had before. So it's really important to know what your body is at the moment and how it's feeling, and then to really think about, have you got any tightness? So is the skin tight? Have you started to notice that you're putting on some sleeves and one sleeve feels a little bit tighter than the other? Is there swelling? So you might visibly see some swelling in the tissues. And also, like, you might take off your watch and you'll see a watch band. So they're all indications that you've got swelling. On your breast, it might just start to feel a bit more fuller in the cup of your bra. The other thing is aching. So sometimes when lymphedema is starting to develop, you can just get a bit of a dull ache in your arm or perhaps in your chest, because there's just that little bit more fluid just under the tissues. And then the other thing is cellulitis. So cellulitis is an infection in the skin. It's really bright and red. I don't tend to see cellulitis very much in arms. We tend to see it a little bit in breasts, but mostly cellulitis presents in people with leg lymphedema. So we do have stages of lymphedema. So they're classified. So stage 0 is that it's there's just really nothing showing at all, but the client might be saying, oh, I feel a bit of an ache in my arm. Stage 1 is when you might get some pitting in the arm. So pitting is when you kind of compress into your skin and it leaves an indentation, or you might take your watch off, or you might have had a sleeve on that's a bit tight, and then when you take off your jacket or something, you've got some indentation. So that's what pitting is. Now in stage 1, so some people might feel that they get a build-up in their arm over the day, but then the body still, because remember we said how it's so adaptive and so clever, it's still got the time to remove that fluid overnight. So the next day your arm looks the same, but over the day you start to feel it kind of filling up or pooling a little bit more. Stage 2 is when the pitting or the arm doesn't reduce on elevation or perhaps even overnight. And by then we're starting to see perhaps some changes of protein buildup in the tissues and fibrosis. And then stage 3 is really, which is the picture at the end, that's quite advanced lymphedema. And that's when it's been there for such a long time that the actual tissue structure, so between the muscle and the skin, is quite fibrotic. So there's lots of fibers, lots of proteins, lots of fatty tissue in there as well that's caught in there, and it's quite hard for the lymphatics then to get the ability to move and open because there's just so much squashed in that tissue there. And the other thing I've written there is lymphoria, which is when a limb might start to leak. Again, we don't tend to see that very often in arms at all. That's mostly in legs, and that's because the legs are so far away from that lymphatic drainage point at our neck. So there's lots of diagnostics that you can have done for to find out if you've got lymphedema or what kind of pathways and things we can use as well. So a therapist that you go to see, the first thing they're going to really do is look. Well, they're going to listen. They're going to listen. I should write listen first. So the first thing they're going to do is listen to you. What are you noticing with your body? Are you feeling any changes? We can then often see just visually by looking at bony landmarks, like I might look at the knuckles on someone's hand from an affected arm to a non-affected arm. I might start to look, can I see wrist bones? Can I see any muscle in the arm? Can I see any skin changes? So there's those things. Then we'll start to touch the skin to see if we've got any indentations or any pitting. And then from there, we can start to use things like volume detectors, and that can be quite simple measuring tape to measure your arm, and then we can put that into a spreadsheet and work out exactly how much volume you've got in that limb. Some of you might have had the opportunity to have some scans done. It's called like a SOZO, is a very new scan that's available, and there's a picture of that down below, and that's something that you stand on, and that takes a bioimpedance. So it pretty much runs like an electric fluid all up your body, up and down, and that can detect if you have swelling in your limbs, how much muscle you've got in your right arm to your left arm, how much is in the intracellular tissue, the extracellular tissues. Like there's all of these different things that can tell. There's also a thing called a lymphoscintigram. They don't tend to do them as much anymore. And that was something where they put some dye perhaps between your fingers, and then you come back, 10 hours later and have an MRI, and they could track then what your fluid and where it's gone. The most probably up-to-date one that we have now is this near-infrared fluorescent lymphatic imaging, which is such a mouthful, and that's over here on these pictures. And what they're doing here is that they've actually put some dye. So here you can see they've put some dye between the person's fingers just here. And if we look at this green, so this is all then done under a fluorescent light. And what they start to do is that they actually do some lymphatic drainage and try and pump that fluid through. And you can see here, they draw on the arm where they can see the lymphatic pathways are, or where there might be what's called dermal backflow. So you can see in this one here that there's quite a bit of buildup in the lymphatic fluid here. There's really one tiny little pathway there. It's pretty much a big build-up through here, and then there's not much going through to the axilla, but we can see a little bit of lymph drainage happening through here as well, and through here. So a therapist would be trying to drain all of this up into this area here and through. And in this picture here, we can see what's called dermal backflow again. So dermal backflow means that the fluid has been trying to take up, but it's just stuck in that tissue between the muscle and the skin. And then we can see, oh, we've got a beautiful lymphatic vessel here. It's up to here. And then this is that subclavian vein point, right? So that's where your lymph enters into your venous system. And then on this picture here, you can see again, there's not much lymphatic action happening through here and up here, but in here we can see a lymphatic vessel going through. So again, a therapist here would be trying to drain across to there, and then for this lady, they'd be going up through the chest here or down to these nodes here. So these, there are places in Victoria and in Australia where you can go and have these scans done. And they're really useful for a therapist because, as you can see, the people doing the scans have drawn these pictures. And so we get those pictures as well. And that shows where you've got great lymphatic pathways to work on and the areas where you've got blockage. So what to do? Like, if you feel that you've got any changes in your body, I think the first thing you should probably do is go on the ALA website and you can look for an accredited practitioner, and they're people who they've done training in lymphedema and they know the whole package of what that they can present to you. And there's public lymphedema clinics. There's also private lymphedema practitioners like me as well. If you're not sure, you can always ask your GP. They should be able to access a referral pattern, or you can contact a hospital or your consultant that you've had some care with in the past. And also, I'm sure at the Living Pink Foundation, they'll be able to direct you as well to some websites you can go to for help. So that's kind of the external thing, and I'll go a quick talk over what those people can offer you. But what can you do? So what you can do is do some really specific exercise and movements. And when you get your copy of this presentation, this over here is a link to 7 minutes of Tai Chi. And I found an app that, well, this one's on YouTube, but you can also download the app. And this one's really good because it's all about moving the upper body mostly in some different movements, like really slow, really extended. Because remember I said the lymphatic system, it's a very slow moving system. So if we're doing exercise like running or moving our arms fast, we're using our muscles, but we're not really getting our lymphatics. We're not getting the pressure to change, to kind of squish on those lymphatic vessels and then open them up to take the fluid in and then the next one down. The other thing you can do is good nutrition, which I've got one slide on that. I'll show you. Skincare is really important, so keeping your skin moisturized as much as possible, staying out of the sun if you can. We just want to keep your skin as healthy as possible. And the other thing is self-lymphatic drainage, which again, I've got a presentation on that as a PDF, which can get sent out to you. And the main thing about self-lymphatic drainage or any kind of lymph drainage is that it's very slow and it's very, very soft. So we used to say it's like patting a cat, very, very slow. One of the things also, and you'll see in the sheet that we send out, is that we always start up here or around this terminus where the lymph enters into the venous system. Then if I'm trying to drain an arm, I'll be doing lymphatic drainage here and then finally to there. So it's always about that pump trying to draw the fluid up, kind of vacuum the fluid back up through the system. Therapists have lots of different ways to help you, and we have what's called a treatment and a reduction phase. And in our treatment phase, we're really trying to reduce the limb as much as possible, or the breast. And if it's a breast that's quite heavy and quite fibrotic, what we're trying to do there is to really get all the lymph moving a lot more efficiently and trying to get the skin soft. So therapists like me, we like to see soft, movable skin. When skin comes in and it's hard or it's pitting or it's really tough and tight, that means there's a lot of fluid under the actual skin. And there's all of these different options now. So 10 years ago, there weren't even a lot of these devices around, and most therapists have access to at least 2 or 3 of these things here. So bandaging is something that can often take place to really reduce a limb if it's got to about, say, stage 2 or stage 3, we'll probably try and bandage. We've got our manual lymphatic drainage that the therapist does to try and redirect the lymph and to try and get those anastomoses or backdoor pathways. We've got then our low-level laser therapy, and I've got one of these lasers. These are about $4,000, and they're fantastic for breaking up fibrotic tissue. The other way to do it is with your thumbs, but the best thing about these lasers, and this is the only one that's actually accredited by the Therapeutic Goods Australia for use with breast cancer, is that it helps to break up that fibrotic tissue. And then what happens is these little cells called the macrophages can go in and clean up around the spaces, and then the lymphatics can start to work a lot more efficiently in that area. And I've seen that work fantastically on clients who have had quite a bit of fibrosis in their breasts post-radiation. The other thing that we can do is lymph taping, and this lymphatic taping, this is all about trying to redirect the lymphatics. And then if we do some kind of taping like this, there's a few different techniques. When you move around, it actually pulls up on the skin. That helps to draw in some of the lymphatic fluid into these initial vessels. And then when you move back the other way, that actually closes the lymph vessel again, and then the other one can start to pump through. We've also got these pneumatic pumps, and this is a breast cancer one. So these can be really great, particularly if your lymphedema is a bit recurrent and you can't get to see a therapist. Investing in something like this is a really good thing to do. The other standard that you'll see is this is a picture of a compression garment, but there's also many wraps around now, and some of those have day and night options and different products in them to help to stimulate the lymph. But what a daytime compression garment is, if you imagine before I was talking about how we've got that space between the muscle and the skin. So we want to stop the filtration of fluid going into that space. So a compression garment squashes that so the body doesn't go, oh, there's lots of proteins over there, I want to send fluid. So a compression garment helps to maintain your lymphatic system because it stops the fluid going into the tissue. But if you've got stage 1 lymphedema, it can also be a really good way to actually treat it, because sometimes your body just needs some help to stop the fluid pooling in that space during the day, and then overnight the fluid is still moving through your arm okay. So just a little bit on compression garments. Your therapist will be able to tell you what kind of class to get. So compression garments come in different classes, 1, 2, or 3. Usually in an arm, we'd be doing a class 1. The knits, then we start to go into all types of different fabrics, and then also the knit. So the knit is if it's a circular or a flat knit. A flat knit is something that we would use if somebody's got some really big folds in their arm, or perhaps like really heavy towards the elbow, because we don't want to have anything going into that space. And that's sometimes what can happen with a circular knit. The other thing a therapist will definitely do is try and work with you. Are you going to be able to put that garment on? This is just a little picture about the different types of pressure. You can get a lot of compression socks from the chemist, like just over the counter, but usually arm sleeves are straight from the actual, through a therapist. So we have to measure you up and order them in for you. Just a couple of other little medical things to talk about. This is some of you might, if you really look under your armpits, we can sometimes see this thing called cording or axillary web syndrome, and that kind of looks like these rope-like lymphatic vessels. So there's some slightly deeper vessels that kind of get slowed down so much due to the interventions that have happened in the armpit that it then starts to get caught in the fascia just above the muscle, and they can actually be really quite restrictive and sometimes a bit painful, but it's actually very easy to treat. And one of the other things you can do is doing things like that Tai Chi, or just really stretching out. So that's why it's good to keep moving your body as much as you can, because you can usually feel if a cording is there. But I would say for most of my clients, if I really look for cording in an armpit, I'll usually find it, but they'll never know that it's there and they won't have any discomfort. So remember we talked about the things that you can do. So one of the things you can definitely do is some exercise. And the Cancer Council, they actually have this fantastic quote that there's such great evidence of the benefit of exercise in fighting against cancer and just really helping to keep your body going. So here's some other links as well, but they really believe that every patient should be prescribed some kind of exercise regime. It's really strong evidence in preventing secondary cancers. So it can be, like they say, it's a bit of a miracle drug in contributing to fighting against cancer. Okay, so but there's some links there to look at. That definitely, people who exercise regularly, who have cancer, they'll usually find that the side effects are a little bit less from the treatments. And there's all that, if you click on those links, you go to the evidence of all those statements as well. And what that means for you for exercise is really just looking for opportunities in your day to be physically active. Participating in planned exercise is really good. So like by that we mean you're going to meet some friends to go for a walk, or are you going to go meet some friends or join a group like water aerobics or something like that, where you're actually moving your body. Planned exercise is really important because you tend to do it if it's in your diary. You should, if you can, include aerobics, so things that get your heart pumping, but also resistance training, and that can be with some light weights or resistance bands. And it should just be moderate, like pretty much moderate to vigorous intensity. But if you're starting, and depending where you are with your journey with your cancer and your recovery and your treatment schedule, this is where you discuss this with a therapist, because you really want to start with a short duration and quite a low intensity. Now, if you're somebody who's run marathons in the past, you probably might get back to doing something like that. Like your ability to run is obviously much higher than somebody else's. So you're really looking at what you're bringing in as well as your fitness level, and to always just progress in very small increments. And also, if you exercise and you seem to think it worsens your lymphedema, you just need to speak to your lymphedema therapist, because maybe we need to put more of a cool down for you. Now, nutrition and lymphedema, right? There's really not much research has gone into it at all. But we know that lymphedema, there's usually a bit of inflammation within the tissues as well. And that some kind of improved nutrition will, it will help your overall health and possibly improve your lymphedema. But as I said, it's limited research. It's varied research. So there's nothing that somebody's done like a specific study. Like they might have done one study in a small cohort just with drinking more fluid, and another study in a larger cohort of people who cut out carbohydrates. It's so varied. There's not much there, but that what we do know is that dietary intake can play a role in the management of your lymphedema because of the inflammation that happens in the tissues. So the general recommendations from all of that is pretty much what most people do all of the time, okay? So we don't want to have any fad diets such as ketogenic. We just really want to keep hydrated, it's general things. Eat from the healthy, 5 food groups, lots of fruit and vegetables. Try and reduce your sugar and high fat and salty foods. And if you can, swap in saturated fats for unsaturated fats. And there are actually some nutritionists around, and I can pass on those details, who specialise in nutrition for people with lymphedema. So I've almost finished. This has been a fast talking event for me, and then I'll take some questions. We know with lymphedema, the early diagnosis always comes to better outcomes. And I think for early diagnosis or early feeling in your body, we need to make sure that you're giving yourself some self-care through skincare, gentle movements, Tai Chi, exercise, and that then we really have an opportunity to help people reduce their lymphatics or really live well with their lymphedema. So to reduce lymphedema or manage it so that you can live well with it, and it's not something that's like, a curse upon you, of something that you have to deal with. So we want to get that down as quick as we can. So now what I'm going to do is I've also got a little bit of a link here, which you'll be able to go to. It's just an interview with me on the radio about lymphedema. But what I'll do now is I will go to stop sharing, because all I've seen are the slides. So if anybody's been waving at me for questions, I apologise. And then I can answer some questions if you've got them, or you might be able to go back. Oh, I clicked on the wrong thing. All right, I'm getting rid of that. So I think everyone can I'm back and everyone can see me now.
Yes.
Great. That was an event, just so you know. That was pretty fast talking for me, so that's why you've got the slides there as well. So if you've got any questions, perhaps you might want to turn your camera on, or you can write it down, or you can email later.
I have a question, if that's okay. I'm Ash. I'm not sure if you'll be able to answer it, but I just thought it was quite interesting. You know how you spoke about at the earlier slides about the different pathways to try and drain, and you mentioned the sternum. So I recently had reconstructive surgery with an axillary clearance, and I've been finding a lot of pressure, particularly on my sternum at nighttime. And when I mentioned it to the consultant, they didn't really understand why. And I'm wondering, would the drainage, would that be part of it? Would that be why potentially I'm feeling that pressure there? Or just wondered if you would know the answer to it.
Yeah, I would certainly say that, like a lot of my breast clients, they sometimes will come and they'll start to feel some build-up on the inner side of the breast where the reconstruction is. So it could be you've just got a tiny bit of fluid build-up. There's a few things you can do. There's a lot of products that you can put in under a bra to help to move the fluid. Or the other thing you can do is just very slowly with your hand try and take the fluid across to the other side. So from that part of the breast across. Also that kind of moving, like doing something like that, like really like big chesty breaths to try and open up your rib cage. That will help to get those lymph nodes in the sternum and those pathways to really activate and start to go through. But yeah, like sometimes also depending on how long ago you had your surgery, we just get a lot of post-surgical fluid as well. So sometimes it's really just post-surgical. But we want to, you don't want to be uncomfortable. You want to keep as much, flexibility and movement within your body as you can. So can I ask you, do you wear a bra when you're sleeping at night? Or
Yes, yeah. At the moment I'm wearing sort of like a post-surgery bra. And it is, I suppose, reasonably early days. I'm technically 5 weeks post-surgery. So some of those movements you speak about, I'm trying to do them, but not very successfully.
Yeah.
Like I'm still working my way up to it.
Yeah.
But maybe, yeah, obviously it's something I'll keep an eye on. I'll try that. But I suppose if I feel like the pressure's still there, maybe I should go and see somebody and actually talk about it.
But yeah, and 5 weeks in, there's probably a lot of post-operative swelling. But the other thing you can do with your other hand is that you can actually just go to the sternum and just do these tiny little circles on the skin just above the sternum, just starting there and then working down. Just do 5 in each spot, and that can help to stimulate that lymphatics across as well. But it probably is just a bit of post-operative buildup that's there, but it's like, let's get rid of post-operative buildup. You don't need to have that.
Yeah.
So do that. The other thing is, if it's comfortable for you, which it might not be yet, is to actually occasionally just lie down on a cushion or something, just to get some pressure on your breasts, because breasts, like when somebody has like surgery or edema in a breast or under a chin or genitals, it's really hard because we don't have the muscle movement like in our arm. So you're really fighting a bit of gravity. So sometimes if we can just get a tiny bit of compression, or the way you're sleeping or things like that, that can change a little bit so that you're not fighting gravity as much. But probably doing these little things, because I'm a Vata therapist, they're called soldiers. So we just do 4 little soldiers going across and down the sternum. So doing that, and then across to your unaffected side. And that, but I wouldn't be too worried that like it's developing lymphedema. It's probably just more post-operative at this stage.
Right. All right. Thank you.
Thanks, Ash.
I had a question.
Yeah.
So when you're doing lymphatic drainage, should you be directing the drainage to a particular point? Like, are you just trying to move it from that point to, say, your chest, or are you trying to move it to a particular part of your body for drainage?
Yep. So that's a great question, because we're always trying we're always aiming to get the fluid, like this is the bit where it enters our venous system. So this is always our endpoint. So if I need to drain an arm, I'm still always going to start at the neck. And then what I'm going to do is trying to clear these pathways. If you've had an axillary clearance, I'm going to take it away from there, but I need to get this going, then this, then I'll eventually do the rest of the arm. And then you do a full clearance over the whole thing through there.
So you're essentially pushing towards that area.
Yeah, it's more like instead of thinking of pushing, we want to be sucking. So we need to clear this. We need to get this sucking. Then we need to clear this to get this moving. So we clear. So if it's someone's leg, for instance, we do the neck, then we do deep abdominals, then we do the thigh, then we do the knee, then we do the calf, then we do the foot. So that it's all about drawing it back up through your body.
Right.
Yeah. So there's a lot about self-lymphatic drainage around at the moment on the internet and on Instagram and everything. But I think the most important thing is to it should always be light, and you don't want to be directing it into an area where you've had some surgery. We want to actually get those other pathways working. So a therapist will, once they've done as a Vata therapist, if somebody comes into me with swelling in their breast, I'm going to be working on their neck, and then I'm going to be trying to take that breast fluid across to the other side, to the unaffected side, down the ribs to the inguinal nodes, over the shoulder, through the ribs, through the sternum nodes. So we've got all of those different pathways. Yeah.
Right. I'll obviously send through that document you sent me to everyone.
Yeah, there's that one. And I think previously I've also sent some things through, but I can send it through again with Tai Chi and self-lymphatic drainage. But I think you might already have all of that information.
Great.
Yeah.
Just before I forget, Ash, do you mind sending me your last name? Because I don't know what your last name is to send you the details. I think you might be registered something else. I can't hear you. You're on mute.
Of course I am. Yeah, well, it would have been registered under Ashling, so it looked like Aisling, if that
Okay.
helps.
Yes, I do have you.
Yeah,
Thank you for that.
thanks.
Were there any other questions?
Yeah, it's Jane here. I've got a question about travel and preventative. Like, is this something you would recommend, like if you were catching a plane overseas, to wear a sleeve as a preventative action, or if you currently didn't have any symptoms, you would just leave it? Like, it seems to be mixed advice out in the world of the internet.
Yeah, that's a great question, Jane. Most like there have been some studies done, and if you don't have any lymphedema, you don't need to wear a garment for a flight. You'd only wear it if you already had some lymphedema and you don't want it to swell. What you would want to do on the flight is just like you're going to flap your feet and things to keep everything moving. You're going to want to make sure that you move your hands, or you might do some little things like that, and try not to have your arms in the same position, just for general lymphatic flow. But no, you don't need to have a preventative sleeve on, only if you've already got lymphedema, of course, and you've got a sleeve.
Thanks.
Where you going? You're going somewhere nice?
Hopefully. Delayed trip from a year ago.
Great. Right. I think that's it.
Question? Can I quickly ask a question? At the moment, I'm only stage 1 lymphedema. I have been stage 2 in the past. Now they're saying that you can now have injections in the arm and blood pressure. I mean, not the blood pressure, the injections. It makes me very nervous. I've had 2 recent minor surgeries, and the first anaesthetist was very rude to me and tried to rip my bracelet off and said, "You can have injections now." I'm getting a bit tongue-tied.
No, I know what you mean, Chris.
I'm very, very nervous. Like, I don't want to go. I don't want any infection or anything.
Well, firstly, Chris, congratulations on doing the work from getting from stage 2 to stage 1 lymphedema. That's fantastic. Secondly, they should really listen to you if you're a bit nervous. If you've got 2 arms, why do you have to have it in that arm if you're nervous about it? But thirdly, they have done some studies, and that certainly if you're just having like an injection, like a blood test or something like that on your affected side, that's not going to cause any problem, is the evidence. They do say that, obviously if you're going to have a cannula in for 5 days, you'll want to put it on the other arm, because that could be a site for infection, and then you could get more, fluid like that. So, I mean, the anaesthetist or whoever it was is correct in saying that, yes, you can have it in that arm, but if it still makes you nervous, have it in the other arm, because you know your body better than anyone else. But the current evidence is for things like blood tests, blood pressure, that kind of thing, that they used to say, no, you can't have anything on that side. Those kind of little simple things are fine, because if you remember before, like lymphedema developing is such a slow moving thing that one little thing like that isn't going to tip it over the edge. But if you've got 2 arms still, why not use the other arm if they can get a good vein on the other arm? If you feel, all right. I hope that answers your question. Yeah,
it does. I actually, after the first time, the second time I was prepared for it, and I refused to let them do the anaesthetize me in the arm, so it was all good.
Yeah.
I was just a bit shocked at the time. That was all.
Oh, I know, and I'm not surprised. And that's the thing, is that they did used to say all the time, don't have anything done on that affected side. But still, if you've got a patient sitting there going, I've got 2 arms, please do it on the other side. It's like, do it on the other side. What's the
Thank you very much. Thank you. Put my mind at rest.
Sorry you had that experience with the medical system.
Anyway, thank you.
Yeah. Great. Well, I think that's probably it. And I might just email through. I'll find those other documents with the self-lymphatic drainage and just the Tai Chi link and this little PDF, because I've taken 5 main exercises out that it's really good just for breast and chest. So if you don't have time to do the whole thing. And then if you have any other questions or you're looking at trying to find a therapist or things, you can always just contact the Think Pink Foundation. I can find someone to direct you through to in your local area.
Big thank you so much.
Thanks very much. That was
Thank
a lot
you.
of information in an hour.
Thank you.
And I'll send that info through as soon as you send me the rest.
I will do.
Thank you.
Okay, thanks everyone. Have a lovely day.
Thank you.
Bye.